Hi, everyone. Thank you for joining us today. I'm Rose Gerber. I'm co-host director of patient advocacy and education, and we're always happy to know that you're out there listening and learning with us. Today, as you can see from our slide, we're going to be giving you updates on a very important patient campaign, a national campaign called Time to Screen Updates. And I will give you some highlights on what we'll talk about you'll see on the next slide. So today, as I do with every one of these chats, I give you some high-level highlights of some of the issues that COA is focused on. And in previous advocacy chats, we talked about the Timely Access to Cancer Treatment Act, and I'm going to go into a little bit more detail about that on the next slide. And the focus, of course, today is going to be the Time to Screen campaign, which you're going to get to hear about from our communications director, Nick Ferreyros. Next slide, please. So it was back in May when for those of you that subscribe to our email list, which we hope you all do, you saw the press release that we were very happy to announce the Timely Access to Cancer Treatment Act of 2021. And I was just thinking about something, that acronym TACT, the word TACT has to do with knowing how to communicate and delivering news in a way that doesn't offend anyone. And what's so great about this is when you reach out to Congress, which is what we're asking you to do, you can see it's the very first line on this slide, ask your congressional representative to co-sponsor HR 3258, that this is an easy ask. And just a little recap, I'm not going to read every detail on this slide, but if you want, you can do a screenshot or you can use your phone to take a picture of this because it has really good information on what this Timely Access to Cancer Care Treatment Act does. And basically, it makes sure that PBMs and insurers will make sure that patients can receive their prescription medication within 72 hours. Now think about this, like something that's just human nature is nobody likes to wait for anything. People don't like to wait in lines. People don't even have the patience to wait for their microwave meal to warm up. Seriously. So imagine how horrible it is to be a cancer patient who's so scared and so worried. And now you know what your doctors told you that you need, what medication you need. And now there's an incredible delay in getting your medication. So this bill addresses that issue. Again, take a photo of this, learn about it. We also have detailed information on our website, but I do want to draw your attention to the very bottom line of this slide. We know that not everyone is comfortable reaching out to your member of Congress. Some of you might not even know who your member of Congress is, and that's okay because we're here to help you. You can reach out to my assistant, Tracy Banks. You can see her email address at the bottom of the slide. It's tbanks@coacancer.org. And we have a very nice toolkit, which Nick, again, will talk a little bit more about during his portion of this talk today, where we give you a sample dialogue. And again, it's just sample. We never ask you to do anything directly. You know, we're not going to put words in your mouth, but we're going to give you guidelines on the key points to mention. So you'll learn more about that later. So thank you again for listening to this. The next slide, please. And I know I'm using the word thank you a lot, but again, just because a word is used a lot, I hope it doesn't lose its impact because I do really seriously want to thank all of you for being a part of this monthly advocacy chat. We launched in 2020. Again, you know, starting anything during COVID is a feat for anyone, but we felt that this was a really good way to give you something positive in your daily lives and your work lives, to educate you, give you resources to become an advocate, to engage other advocates. And now we just celebrated our 1-year anniversary. So thank you so much for being a part of that. We've had thousands of participants in our audience. You can see from this list, again, this is kind of the pictures are kind of small, but hopefully all of you remember these incredible speakers that we have, practicing medical oncologists, CEOs of cancer centers, cancer organizations. We were really proud to have them dedicate some time to teach us about what they're doing. And speaking of these esteemed speakers, Trish Goldsmith, who many of you know is a CEO of Cancer Care, and also you know Cancer Care because we partner with them on Time to Screen, which is Nick is going to talk to you about. Trish Goldsmith was just recently recognized by Forbes magazine as one of the 50 women over 50 that is very influential and has done great achievements in her life. And she certainly has done a lot for patients, as all these other speakers have as well. So thank you again for being part of this. Continue to join us every month. It's only 30 minutes. And now I'm going to turn it over to Nick Ferreyros. And you can see he's the only one, if you look at these pictures, who's now being brought back. So Nick, the pressure's on you. Thank you.
Thank you, Rose, and congratulations on a year of success with these chats.
Thank you.
I think you're gonna really, you really can go back and watch all as they've evolved on YouTube and how great they were, especially last month with Brenda. I thought that was really
Yes.
wonderful, and sort of behind the scenes look at how practices work and the important people that are there, including our oncology nurses. So as Rose mentioned, I'm going to talk about Time to Screen, which is our public awareness campaign to drive cancer screenings. And what was behind this is that obviously with the pandemic, very reasonably, everybody hunkered down and started canceling their appointments that they would regularly have for their mammography or the colonoscopy or even their skin cancer checkup with their dermatologist. And we saw this as an organization of oncologists. We saw this firsthand in our practices. It was very scary because when you put off your regular cancer screening, that means that if you were to present with cancer later on, it would most likely be at a later stage. That makes it much harder to treat. It makes it much more expensive to treat. Unfortunately can lead to worse outcomes for patients. And that's something, of course, none of us want to see happen. So we saw this going on. The doctors raised the alarm within COA, and so they challenged us as a team to come up with a public awareness, public service campaign around this, and that's the result of Time to Screen. Of course, we are just one part of the equation. We at COA, and then of course our patient advocates at CPAN, but we also like to strengthen our advocacy community. So we partnered with Cancer Care. We have a very long history of working with Cancer Care. I've only been at COA for about 6 years now, but in those 6 years, we've worked with Cancer Care a number of times, including multiple hurricane solutions for patients in regions that were affected by it. We also, during the pandemic, worked on a transportation program for patients. So there is a lot there, and Cancer Care, of course, runs several wonderful hotlines and support services for patients and family members and caregivers dealing with cancer. What is the campaign? We've said a lot of things. The campaign has really come down to 3 things: education, solutions, and safety. Education, obviously, it's reinforcing that which many of us already know, but so, isn't important to remind us is that regular cancer screenings are important, and you can take control of your health by having them. Of course, during a pandemic, that isn't very easy sometimes. So
Right.
we provide solutions and really help folks out. So make it easy. That's where our friends at Cancer Care come in. They provide some of the solutions and provide support in doing that and making it easy. And then, of course, we're all scared right now. There's a global pandemic. There's a lot of unknowns. Now maybe a little bit different, but think back to where you were a year ago. Still a lot of unknowns, no vaccines at that point. But practices did shift and pivot very, very quickly to keep their doors open. And they did it safely. So more social distancing with patients, mask usage, regular testing of staff, reducing the number of outside people that can come into the practice beyond just patients. So we wanted to make sure and reinforce that message for everybody. And those are the 3 parts of what Time to Screen is. Now, how does that result in things? First things first, consumer tools. We set up a 1-800 number with Cancer Care that is staffed by licensed clinical social workers who deal with oncology issues. And they can help provide all sorts of support, from everything from scanxiety as we say, to helping people find screening locations. And they do that by putting together a comprehensive database of screening locations and options across the country, regardless of insurance type. And we also built out a great website. If you haven't been to timetoscreen.org, that is a great site, a lot of information there. You can share it also within your communities. We, of course, have a strong stakeholder community between COA, Cancer Care, and CPAN. So that's actually a really important part of why we're having this webinar right now is getting our communities activated and up to date on it. We also have lots of different affiliations with other stakeholders like clinicians, employers, and then of course in our markets where every practice that COA has members is, we work on amplifying it there, and you'll see some great examples of that in a little bit. And then last but certainly not least, public awareness and advertising. We have a great celebrity spokesperson that I'm going to play a video of in a second. They recorded public service announcements, and then we did a ton of media outreach. You'll see some of the results of that. I'm going to take a quick pause right now and play us a little video of our spokesperson, who is Patti LaBelle. Patti came to us as a great person. She's got a wonderful personal story, and of course, you will see that she is a fantastic spokesperson for the campaign.
Cooking is all about knowing when it's time, like when it's time to add some salt, when it's time to add some oregano, and when it's time to take it off the burner. And since we're all getting a little older, it's time to get screened for cancer. It could save your life, and it's easier than ever. Just call or go online, and we'll help you find a screening location that works for you. It's just like cooking. When it's time, it's time. Time to screen.
Nick, thank you. I was reminded again of how much we enjoyed being part of being in the studio virtually when Patti was filming. And for those of you who participate on the chats earlier, something that I shared and we all definitely felt is she was so warm and so authentic and just a really fun person. And it was so important for her to do this campaign. So we were just so proud to have her as our celebrity spokesperson. She has a really fun nickname too, the Godmother of Soul. Like, what a great nickname that is.
She also has a really unfortunate history with cancer.
Yes, that's the sad part.
That have both died of cancer at a very young age. Also, the inspiration that got her into singing, her choir teacher also had cancer. So she's definitely experienced it firsthand and brought a lot of passion to this issue for us. So you saw that video, that public service announcement from Patti, along with some video film advertisements and posters. You can see an example of one here, like on a bus stop. Those are out right now and are really making an impact. We have actually been live since April, and the PSAs went live about a month and a half ago. And we really have then started ramping up by focusing on our various audiences. We've got toolkits for practices. We also today are releasing an advocacy toolkit and an employer toolkit. So you may say to yourself, why employers? Well, of course, employers, many of us have health insurance through our employers. And we have heard firsthand that they're very concerned because they, of course, do not want their employees, the men and women that they work with every day, to have to deal with cancer any more than the rest of us do. And they're seeing the same trends in their insurance plans of less cancer screenings. So they asked, could we put together any materials that they could use? And we did that. But of course, this webinar is for our advocates. Our grassroots advocate army is strong. CPAN has been there for a long time and we've got chapters across the country. And so this advocacy toolkit, I'll go into some details about it later, will be very helpful for you. Some of the, talking about things that we're very proud of, we launched, as I said, at the end of July, and in just a few short weeks, got almost 266 million media impressions. That means eyeballs on our articles, people who've watched our videos, 61 national media outlets. You'll see some headlines in a minute. Our PSA has kicked off and it's been really great. Here you'll see from the launch, this is Times Square in New York City, right on the big screen there, next to the Hard Rock Cafe. So we're definitely getting some eyes and attention there.
Nick, I have to jump in for a second. I believe it was yesterday, I saw a video clip with Gail King, and she was behind the scenes in Times Square. And it was really incredible, the reach with Times Square, like the views around the world because it's Times Square. It's really fascinating. It's worth Googling. So yeah, the exposure just simply in that one location is global. It is a phenomenal achievement.
Thank you, Rose. Yeah, we're really proud of that. You know, and then of course, in addition to Times Square, all the national coverage, Self Magazine, Yahoo. Little known fact that Yahoo is actually the third most trafficked website in the world. Really proud of what we achieved there. You can see several great clip examples here. Then we did it locally too. We know that our practices are powerful voices within their communities. And we said, well, what a better way than to have them step up to the microphone and tell the story and tell their things firsthand. So we were featured in 26 states so far. We continue to do media outreach around there in print and TV and radio. Really great stuff. And you know, we also took our practices and had them do some PSAs. And I'm going to show an example of one as well now too.
Americans made the right decision to stay home during the pandemic.
For many of us, that also meant putting off important cancer screenings that could save your life.
Now we are seeing cancers that could have been caught and treated earlier.
That's concerning because with cancer, you never want to find out too late.
As we get back out there and visit friends or get haircuts, make time to schedule your doctor-recommended cancer screenings, such as mammograms and colonoscopies.
Most cancer screenings are free or low cost, and there are plenty of local options even if you are uninsured.
Find a convenient screening location at timetoscreen.org or by calling our toll-free hotline at 1-855-53-SCREEN.
America, it's time to take charge of your health. It's time to screen for cancer.
I just love that PSA. Like every one of, every one of those doctors is taking care of patients every day, all day long, through COVID, through the Delta variant. And they recognized how important this is and took time to, you know, share that message and their knowledge. It's just, I love that PSA.
And you know, we're very lucky that we've got a lot of active practices, as you can see here, across the country, including CPAN's very own medical co-chairs, Dr. Atkins, Wall. And you know, we are taking those videos and we're sharing them also far and wide, because we also know tailoring things locally is important. And so you can find all of those videos and more on our YouTube channel. Oncology COA is the YouTube handle, but you can also probably find it on our website, in the footer and everywhere, and revisit those. So we're very proud of that. But of course, we've also done a lot internally as well with the Time to Screen, and our digital traffic is really going through the roof. I mean, in just a few short months, we've got 25,000 visitors. I think these numbers have actually grown significantly since I put together this presentation. A lot of digital advertising. We're also putting digital advertising behind this. Millions of people seeing our ads, getting reminded, and that's a public awareness campaign. Isn't really about selling you a product or getting you to do one specific thing at one time. It's about reminding you to do something and getting in your head that you need to get back to your cancer screening. And that is an important part of this campaign is repetitive reminding people about all of this.
And also, just something for our audience too, like with COA, we do pride ourselves on always bringing you very topical, timely information. But this is the second time where we're talking about Time to Screen. What we're also known for is continually to beat the drum when something is really, really critically important, and screening is critically important, which is why we decided to make this our topic. It's a short week. We know everybody just came off a Labor Day weekend and, just easing their way into work. So again, it's important. This is why we're doing this again. It's important.
Yep. And of course, for those of you watching, if you haven't gotten your cancer screenings or scheduled them, now that you do your fall to-do lists, putting away your summer clothes, Rolodexes and schedule your appointment with your doctor. It's very important.
Only the East Coast people get that, Nick.
Well, we're getting ready for winter here. But of course, social media, right now we're on our computers, we're holding up, we got our phones every day, all the time. And so we put a lot of effort into there. Patti, of course, did some social media posts with us. And they're getting a lot of attention. And, as those of you who attended the CPAN Advocacy Summit in July will remember that from our social media education and how-to sessions, they have a lot of reach, and there's a lot of opportunity there for you to get involved, both in this, but also, for example, Rose mentioned the TACT Act. And there's always going to be plenty of opportunity for you to engage in social media activities with COA. So be sure if you did not attend that, you can watch recordings of that through the CPAN website, coaadvocacy.org, and watch the video and learn how to do that. But also, when we get to the toolkit, there'll be a lot of opportunities in there for you to engage. Just a few highlights of the social media activity on Twitter and Facebook. Of course, we've reached out to politicians because we know they have big platforms. So Senator Cassidy in Louisiana helped out with that. New York Cancer and Blood Specialists, a very, very active COA member. We thank them for doing that. So, and of course, Patti and our corporate sponsors and Amgen and others have been actively involved in this. So every voice counts, every person that sees this message, really, it helps out.
Nick, just real quick too, we know that we have audience participants right now. In fact, we got a message on our chat regarding lung cancer that many of you are specialists in your own disease state, whether it's breast, prostate, rectal, lung cancer. Share your education with others. So if there's something that we need to know, you can share it on Twitter. And again, always think of tact, so you can be tactful, which I'm sure you will, and let us know. But if you want to learn more about specific screening for your disease type, there's a lot of information, again, that you may have to seek out on your own. We're bringing you as much information as we can, but when you ask us questions, it helps us learn as well. So keep asking us your questions and educating us as well. Thank you, Nick.
A good question here about cancer-specific type awareness, specifically lung cancer. Lung cancer is one of the cancers in the campaign. We actually just this week also put up cancer type-specific fact sheets for the Time to Screen campaign. So if you go to the site, that's a new option in there. You can download a PDF for, say, lung cancer and why it's important to get screened for lung cancer. But also, of course, this is a great reason why we have our advocacy toolkit for this. If you go to the Time to Screen website, on the main menu, there's an option for Get Involved, and you'll see all of these options here. And basically everything I've shown you today, plus a lot more, you can download there and use in your own efforts. And we are very happy for people to take it, rip it off, do whatever you want with it, as long as the message of screening gets out. That's all we want. So if you want to rebrand this stuff, you can do it. The only thing we can't do, unfortunately, is Patti LaBelle stuff, because she is a very important celebrity, and they have a lot of controls over their likeness and images. But anything else, if you want to use it, use it. If you want to take our resources, please do. And most of what we've done is made it very tailorable, specifically toolkits. You can customize those. You can customize them. They include everything you want. Op-eds, you can write your own PSAs, You can do letters to the editor. You can social media posts. It is all there for you to use. And we really want to get as many voices to join this effort as we can. And that's the whole purpose of these toolkits. If you're a practice, there are a lot of resources in there for you to communicate to your patients and survivor communities. If you're an employer, there are tailored resources there for reaching out to your covered lives. And then, of course, if you're an advocate, and it's everyone from those in active treatment to survivors to caregivers to even the staff in the practice that want to do their own stuff. We have a big platform for everyone to join us, and we really want everyone to get involved.
Yeah, and Nick, too, this is an important reminder for everyone, is that as advocates, and I like to say that we are all advocates because we are all advocates, we have an opportunity to bring value to others. So whether you choose to do this as an individual, or for those of you that are part of national advocacy groups or state-based advocacy groups, when you take this advocacy toolkit to them, which Nick just shared, can be customizable, you're going to be bringing value and education to patients where it really matters. So that's the ultimate form of patient advocacy. And then again, since this slide is still on the screen and you look at what is available, guidelines on op-eds, PSA, or public service announcements, by the way, is what PSA means for those of you who aren't in communications. Everybody has a different way that they like to communicate or what they consider their skill set. There's a lot of people that are very nervous with public speaking. So, but maybe you're a great writer. So write a letter to the editor. Again, everybody needs content. So what a great way to bring value to so many people by using these resources that we're giving to you, at no cost. We just want you to use them and join us in our advocacy work. Thank you, Nick. This has been really great information. Is there anything else you would like to share before we introduce our next month's guest?
Well, I just want to say, our goal here is to get more people back to their screenings, and of course, following CDC guidelines and U.S. Preventive Task Force guidelines. So this is evidence-based cancer screenings, and we want to get people back to their screenings. Hopefully, maybe detect earlier cancers, save some lives along the way. But it's very important for this. So, all of these resources are designed to be very easy to use. They're customizable with little effort. There's a lot of how-tos in these toolkits and guides for you to use them. So, please, it's on timetoscreen.org, and then you can see right in the top of the menu item, get involved. And there's lots there for you to use.
Thank you, Nick. Excellent updates. And I always get excited about introducing our next guest. October is Breast Cancer Awareness Month, which is the second most common cancer in women. So you're going to hear from Stacy Lewis. Many advocates know her. She's been in the advocacy space for a long time. She's a Chief Program Officer and Deputy Chief Executive of the Young Survivor Coalition. So she will be discussing issues like breast cancer in general, specific issues related to young breast cancer survivors. We'll be talking a little bit about some of the health equity issues that are going on in the nation right now. And it's going to be another engaging talk. Thank you for joining us on this 4-day work week. Thank you, Nick. And thank you again to all of our listeners. Enjoy the rest of your day.